Hey, Polly.
Hey, Greg.
How are you today?
Good. How are you?
I'm all right.
Who's on the podcast today?
Another one's going to shame me. We got the Department of Health.
They're going to shame you.
They're going to shame me because, every day I say I'm going to eat better. Every day I don't eat better.
Yeah.
But this is a good one. This is we have Erica Hanson on from the Department of Health. She's the Community Health Network Manager. And I'm familiar with some of the work that the Community Health Network does because of our blood pressure program.
Yep. Yep.
We're going to learn about that and some more stuff. I remember it was, the program ended, so be curious to see if that's going to start back up. But it's very beneficial for those who we got to try it out.
Yep.
But she's gonna, give us that information and a lot more. See what else is going on over at CHN.
All right. Can't wait to hear about it.
All right. So without further ado, today joining us on the Totally Preventable podcast, we are joined by Erica Hanson, the Community Health Network Manager of the Rhode Island Department of Health. Erica, how are you doing today?
I'm doing great. How are you?
Good, doing good. Thanks for joining us. Really, really excited. Got a few questions for you and hoping that you can enlighten our entire community on what great work you're doing.
I am very excited to be part of Totally Preventable.
Right. So to start us off, can you just tell us a little bit about yourself and how you got to where you are today?
Sure. So I am pretty new to the role of Community Health Network Manager at the Department of Health. I've been here for just about 4 months. I joined the role with more than 20 years experience working with a community-based organization as the Director of Community Impact, and that was with the Rhode Island Community Food Bank. And at the food bank, I managed our statewide membership network of community food pantries and meal sites, and I also oversaw our nutrition and community outreach programs. So I bring that community-based experience here to the position at the Department of Health.
No, right.
Awesome. I have some questions around that, but I'll save them for another day.
Okay.
I have a son very interested in SNAP benefits and how to increase them.
Oh.
But so I'm not sure if he listens, but if I didn't mention it and we were talking about food pantries, I think he'd be upset.
Yeah,
so,
he listens.
Yeah.
He listens.
Okay, I definitely have connections for you there.
All right, super. Okay, can you tell us what the Community Health Network is?
I would love to. The Community Health Network is funded by the Rhode Island Department of Health, which is within the Center for Chronic Care and Disease Management. The center is devoted to improving care and health outcomes for people with or at risk of chronic conditions. And one of the ways we do this is through the Community Health Network, which is a centralized referral system for evidence-based lifestyle change programs. The Community Health Network is implemented in partnership with an organization called RIPEN. At RIPEN, patient navigators accept referrals and connect people to free lifestyle change programs and classes. And the programs and classes have been proven to help people take control of their health under the guidance of trained facilitators. People can find out more about the Community Health Network at ripin.org/CHN.
What types of programs does CHN offer?
The Community Health Network offers a wide variety of evidence-based lifestyle programs. I'm going to talk in depth about a few today, but they include a program called Ready for Health, which is a diabetes prevention program, the Healthy Heart Ambassadors blood pressure program, other programs around managing chronic pain and understanding Alzheimer's and knowing the risks, signs. Also programs around fall prevention, balance and movement, and more.
So I'd love to hear more about all these different programs.
Okay, I would love to say though that the Community Health Network would not work without the support of community-based organizations and healthcare organizations. So a few, in addition to RIPEN, that we work with include Coastal Medical, Prospect Health, the Alzheimer's Association, Lifespan Community Health Institute, Progresso Latino, Rhode Island Nutrition Therapy, Rhode Island Geriatric Education Center, CareLink, the Children's Youth Cabinet, Oasis International, the Newport Prevention Coalition, and other Rhode Island Department of Health programs. And if it's okay, I'd like to share a little bit of stats, facts, and figures around chronic disease.
Sure.
Absolutely.
Okay. So according to the Centers for Disease Control and Prevention, chronic disease is defined broadly as conditions that last 1 year or more and require ongoing medical attention and or limit activities of daily living. Major chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. 6 in 10 adults in the United States have a chronic disease, and 4 in 10 have 2 or more chronic diseases. In Rhode Island, almost 50% of the population has a chronic disease, and more than 20% have multiple chronic diseases. So the Community Health Network connects people to programs that help them prevent or manage their chronic conditions. Getting into that a little bit further, I wanted to talk about heart disease and stroke a bit. High blood pressure, which is also called hypertension, is common yet a dangerous condition. Having high blood pressure increases the risk for heart disease and stroke, which are 2 of the leading causes of death for Americans. And lifestyle behaviors such as not getting enough regular physical activity can lead to high blood pressure. And certain health conditions such as diabetes and having obesity can also increase your risk for developing it. High blood pressure can damage your health in several ways. It can seriously hurt important organs like your heart and damages your arteries by making them less elastic, which decreases the flow of blood and oxygen to your heart, which then leads to heart disease. High blood pressure usually has no symptoms though, so the only way to know if you have it is to get your blood pressure measured. In Newport County, about 35% of the population, that's about 1 in 3 people, have high blood pressure. The good news is that in most cases, you can manage your blood pressure to lower your risk of serious, more serious conditions. The Community Health Network's Healthy Heart Ambassadors blood pressure self-monitoring program is slated to come back this spring. The program includes 10-minute one-on-one meetings a couple of times a month and 1-hour monthly group meetings for a total of 4 months. It teaches individuals how to accurately measure their own blood pressure and encourages people to share the results with their healthcare team. It's a program that empowers people to take charge of their health. And we're hoping that we'll be able to work with strategic prevention partnerships and the Newport Prevention Coalition to deliver this program again, which they have done in the past with Eat to Live Newport. So stay tuned, check out the Community Health Network calendar to find out when that program is coming to your community by going to ripin.org/CHN.
I know you're going to have a new person signing up for that.
Yes,
Yeah.
I hope so.
We had one of our colleagues here brought in a blood pressure cuff, and we did a voluntary blood pressure check, and I won.
Everyone was
Nice.
very excited to do it. However,
So
when the
what-
program was available,
Yes.
But I won the highest. It wasn't very nice.
Oh, you won the, oh, okay.
Yeah.
Right.
Yeah. So I will, if Greg participates again, I'll be joining the crew.
that's right.
Oh, that's so awesome. Love it. So again, another program, I think it aligns beautifully with Totally Preventable. A lot of the programs on the CHN are about prevention, also management, but prevention is a key component. I don't think it's really talked about as much as it really should be. So moving along to diabetes, if that's okay with you, just wanted to share some stats around diabetes. More than 38 million Americans have diabetes, and then another 98 million adults have a condition, a reversible condition called pre-diabetes. Diabetes is a chronic health condition that affects how your body turns food into energy. So your body breaks down most of the food you eat into sugar or glucose, and then releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body cells to then use it as energy. And this way, your blood sugar doesn't build up and get too high within the bloodstream. But with diabetes, your body doesn't make enough insulin, or it doesn't use it, or it can't use it as well as it should. And when there isn't enough insulin, or when your cells stop responding to insulin, too much blood sugar then stays in your bloodstream. Diabetes can cause serious complications, including heart disease. In Newport County, about 9% of the population, or nearly 1 in 10 people, have diabetes. With pre-diabetes, which when I came onto this job, I was very surprised to learn about pre-diabetes and the statistics around it. In the US, more than 1 in 3 people have pre-diabetes, and 80% of the people who have it don't even know it. With pre-diabetes, your blood sugar levels are higher than normal, but they're not high enough for a type 2 diabetes diagnosis. Pre-diabetes, of course, then raises your risk for type 2 diabetes, but also heart disease and stroke. And there isn't a cure for diabetes, but eating healthy foods, getting enough exercise and sleep, managing stress, and losing weight or maintaining a healthy weight can really help manage and improve the condition. And it can also help promote healthy brain and cognitive functioning. For people who have pre-diabetes, there's a program in Rhode Island, a diabetes prevention program called Ready for Health. It's a Center for Disease Control and Prevention recognized lifestyle change program that can help you take healthy steps to reverse the condition before it leads to diabetes. Ready for Health is a community health network program, and it helps people to build healthy habits that last a lifetime. I can share some of the key components unless you have any questions.
I'm all in on what you're
All
talking.
right.
We need help on, I think Greg and I more recently since my blood pressure debacle. But before that, Greg ate healthy. I've been eating healthy, but we have colleagues that bring in munchkins.
Oh yes.
Yeah.
We're
Yeah.
trying to do a good job, but you know,
It's
Yes,
it's hard sometimes.
I know. And you know what? Like, what's life without? You can't deprive yourself of a munchkin every now and again either. So,
Or a few, maybe.
yeah. Or if, that's the thing with munchkins. It's like,
Right?
I'll try one of each kind, and all of a sudden you've eaten like 2 donuts worth. I know. They're smart, those Dunkin' Donuts people. They know how to do it.
right.
All right, so a little bit more about Ready for Health and what people can expect in that program is that it's a curriculum filled with lessons and handouts and resources that help participants to make healthy changes. It's led by what are called lifestyle coaches that go through an intense training to lead the program. And the lifestyle coaches help participants to learn new skills, encourage them to set and meet their goals, and to keep them motivated. It's also a wonderful support group of people in that class with you with similar goals and challenges. And so they together share ideas and celebrate successes and work together to overcome some obstacles that they meet along the way. In some of the programs, the participants really stay in touch with each other when the program is over, or even between the times when the class meets. They really become lifelong friends, which is wonderful. Ready for Health is a long-term program. It lasts for a year. In the first 6 months of the program, participants meet about once a week. And then in the second 6 months, it tapers down to about once or twice a month. In the first 6 months, the participants really learn how to eat healthy foods without giving up all the foods that they love, ways to add physical activity to their daily life, deal with stress, cope with challenges like choosing healthy foods when you're dining out, things like that, and also to get back on track when they stray from their plan. In the second half of the program, participants enhance the skills they learned in the first part. And hopefully they're able to maintain the challenges that they've made up to that point. making lifestyle changes is an ongoing process. It's not easy to do. But so that's why staying in the program for the full year is really essential to help to stick to the new habits and avoid slipping back into old habits. For participants who haven't reached their goal in the first half of the program, their lifestyle coach and other members of the class will help them to succeed. So I just wanted to share how people can access Ready for Health here in Rhode Island. Ready for Health is for people who are 18 years or older and who are overweight and who have been diagnosed with prediabetes or have had previous diagnosis of gestational diabetes or have scored high on a risk test. And I'll talk a little bit more about the risk test in a minute. Ready for Health is not for people who are diagnosed with type 1 or type 2 diabetes or for people who are currently pregnant. So the risk test, I would say it's not even a couple minutes. It really takes a couple of seconds. And it's really like general questions that help people to determine if they're at high risk for developing diabetes. And that, in addition to being 18 or older and overweight, makes you eligible to participate in Ready for Health, which is a no-cost program to participants. Like all of the programs on the Community Health Network are no cost to the participants. So I would encourage all the listeners to check out their risk by going to health.ri.gov/diabetes/about and then /prediabetes. It just takes a couple of seconds. And, you know, it sounds like you guys over at Totally Preventable are doing these little health challenges with blood pressure cuffs. It would be interesting to do that maybe together and to see if everybody's checking out okay.
Yeah, and Eric, you just reminded me that I need to get some photos of Greg planking.
Oh,
We gotta.
Ooh,
I almost
that's
forgot.
impressive.
I need to do that for tomorrow, right?
yeah.
Oh, all right.
Air
Yep.
wig is-
Another health challenge.
Now, one thing I love about these podcasts and having the different organizations on and we hide behind the facade that we're just educated in the community, but I get educated as well.
Mhm.
I am going to throw myself out there and say, I did not know that your body produced insulin. I thought insulin was just a medication.
Oh.
I did not know that. And I probably have a biology teacher somewhere very upset, but I might have been absent.
Yeah. Well, and I also think, you know, for those of us who, well, I'm going to assume I'll speak for myself, who, you know, I mean, I'm not a registered dietitian. I'm more of like a community-based person who is always interested in learning, curious about learning more, and helping to keep our communities healthy in lots of different ways. But what I've sort of come to do over the years is to be able to digest this information, which can seem like overwhelming, and put it into terms that we can all understand, whether you've passed your biology class in 10th grade or not, just to see how like it put it in a practical sense. So my insulin's working well, yours isn't, you know, and how does this affect you long term, and what are the ways that we can try to help? So yeah, that is a lot of great stuff about Ready for Health. I hope that this piques other people's interest too in just learning about diabetes and pre-diabetes, and also accessing Ready for Health. Again, I mentioned some of the partners that we work with who deliver the program in their local communities with the lifestyle coaches. They are, from those who I've met, are very enthusiastic and passionate about what they do. And people who go through the classes, even though it's a one-year class, I was just on a call an hour or so ago. We're already talking about what's next. People want to take the class all over again because of the relationships that they've built and the successes that they've hit. And so how can we keep encouraging this? Same thing with the Healthy Heart Ambassadors. After 4 months, and people have really sort of learned about high blood pressure and how they can manage it without medications, et cetera. Like, you want to keep that going. You want to keep that enthusiasm and energy going. So, so it's sort of a great challenge to have, is how do we continue this great progress and these healthy habits that have been developed. So the last, but definitely not least program I wanted to talk about sort of through the Department of Health is Alzheimer's. And then we can talk a little bit about the other programs on the Community Health Network. But for Alzheimer's, Alzheimer's disease is the most common type of dementia. It's a progressive disease beginning with mild memory loss, but it can lead to the loss of the ability to carry on a conversation and to respond to your environment. Alzheimer's disease affects about 5.7 million Americans, including 1 in 10 adults aged 65 and older. Scientists do not yet fully understand the causes of Alzheimer's, and there is likely not one single cause. There are several factors that can affect each person differently. Chronic disease such as diabetes and hypertension are believed to increase a person's risk of dementia, though. That's why preventing and managing chronic disease is so important. Age is the best known risk factor for Alzheimer's, but it does not only impact older adults. In Rhode Island, 1 in 9 individuals as young as 45 years old are reporting what's called subjective cognitive decline, which is a self-reported memory problem that has gotten worse in the last year. Researchers believe that genetics play a role in developing Alzheimer's, but genes do not always equal destiny. A healthy lifestyle may help reduce your risk of developing Alzheimer's. And 2 large long-term studies indicate that adequate physical activity, a nutritious diet, limited alcohol consumption, and smoking can help greatly reduce the risk of getting Alzheimer's. Researchers are currently studying whether education, diet, and environment also play a role in developing the disease. There's growing evidence that people who adopt these healthy lifestyle habits, like getting regular exercise and managing their blood pressure, can lower their risk for getting dementia. Changes in memory and thinking are typically some of the first warning signs of Alzheimer's and related dementias. And the Community Health Network currently has 2 Alzheimer's programs to help people understand early detection and sort of the differences between Alzheimer's and other dementias. So the first one is called Knowing 10 Signs, Early Detection Matters. And the other one is Understanding Alzheimer's and Dementia. And our friends at the Alzheimer's Association deliver those programs to the community for their caregivers, for the caregivers of those who are living with Alzheimer's and dementia.
So how can people learn more and get services?
Yes, so actually, by the time this airs, so we might be cutting this out, on March 11th, we're giving the Community Health Network page that is housed on Ripen's page a facelift. So it's going to be more user-friendly on that page now and moving forward. There's a calendar, there's a class listing there. You can click on it, register for a class. So I'll just kind of jump into the rest of the Community Health Network things. To wrap up the chronic disease and prevention piece, in general, taking control of your health and managing a chronic condition means the following. It means getting exercise, eating healthy foods, going to all your doctor's appointments, and building healthy habits into your daily life. That sounds very easy to do, but we all know if it was so easy, we would all just do it, you know? But there's built-in challenges around that, depending on where you live and access to some of these things. But it really boils down to sort of those 4 key components. We talked about a bunch of Community Health Network programs that are right out of the Department of Health. In addition, the Community Health Network offers classes and programs on chronic disease and pain management, tobacco and nicotine cessation services, fall prevention, balance and movement, and also family life support. So people can go to ripin.org/CHN, that's RIPIN.org/CHN, to view all of the programs and details. And I think the unique thing about the Community Health Network is that we employ 2 full-time bilingual Spanish certified community health workers who serve as patient navigators at RIPEN. They help people find the programs that will best fit their needs. They help to ensure the best possible outcome for the person registering for a program, and they do what they can to support them in keeping up with the program. They also identify and address barriers to program participation, such as transportation or childcare or language or anything else that could prevent somebody from successfully enrolling and participating in a community health network program. So it's not just you register and somebody like just does an admin function and pops you in a class. They are talking with the registrants. They're for the longer term classes like Ready for Health, they're reminding them that a class is coming up, or they have the option to get like a text notification reminder. They're checking in with them, you know, in the first few weeks saying, how's it going for you? So there's a real sort of human piece to that. So it's not just in the class with the lifestyle coach that participant is feeling supported, but also through the patient navigators. So in addition to that, the Community Health Network also offers sort of opening a line of communication between the participant and their doctor or their healthcare professional. It's what we call multi-directional feedback, which is a unique feature of the Community Health Network. So with their consent, when a person enrolls in a program like Ready for Health, the participant's referring healthcare professional can be notified and updated when that participant reaches certain program milestones and when they've completed the program, which is, I think, a wonderful and empowering thing, is to kind of have that line of communication opened with your healthcare, your doctor or your healthcare professional. So we can let them know this person is midway through Ready for Health and they've hit certain like physical activity minutes, and it's a positive and encouraging function of the Community Health Network. So don't forget to check out the website at ripin.org/CHN, or you can call and speak directly with the patient navigator at 401-432-7217 at any time. If you have any questions, if you don't want to go and look for the class on the calendar, you can just express your interest, and one of our patient navigators will be more than happy to help.
That is awesome.
Yeah, this has been a lot of great information.
Yep. The patient navigator makes it even easier for you. So,
Yeah.
wow. You've dotted all the I's and crossed the T's over there.
Okay, that's great.
Well, this has been a wonderful learning experience. We thank you so much for taking the time to talk with us and help educate the community about all the great work that's happening over at CHN.
Thanks for letting me be part of Totally Preventable. I have shared already with some of my colleagues that I was going to be doing this with you, and I think that there are some other really great programs that you would probably love under the realm of Totally Preventable to highlight as well. So if you don't mind me sharing your information with them, or if you want me to kind of send a bridging connection with you guys. I think that there's a lot of fantastic stuff going on at the Rhode Island Department of Health that people can really benefit from.
Right.
Awesome.
We'll take that connection.
Yes.
Okay.
The community wants to know.
It was great to meet
Great.
Right.
Oh, you too. Have a good afternoon.
As
Thanks,
well.
you too.